So I'm here with my client Joanne, and I'm just going to talk about how you'd use the LymphaTouch machine with somebody who's had a C-section surgery. The LymphaTouch machine is a great machine providing negative pressure and is something really helpful for those scar adhesions, that C-section overhang that a lot of clients are concerned about. But also it isn't only for that C-section overhang, it's just really good to stimulate healthy tissue all around the area where you've had surgery. So the device I've got here is the LymphaTouch Pro, but you could still follow all of the advice that I'm giving today if you've got the older device. So the LymphaTouch Pro, different from the LTO1, which is the original device, which is a bit smaller, actually has a separate attachment, so the hose isn't attached all the time, that simply slots into place. Once you've slotted that into place, you simply turn the device on and the screen will come on. This one comes with a vertical attachment where you're going to use and the suction cup at the bottom. We've got a selection of cups that come with the LymphaTouch device of different sizes. Now the larger cups are going to be much more intense and a lot stronger than the smaller cups. And each time you use a cup you need to use a filter as well. So I would say the largest cup I'd only use on scars that I've treated quite a lot. The medium cup I'd use around the abdominal area, but definitely the smallest cup and the medium-sized cup are really ideal for treating scars. So I'm going to get those two out ready. The way that it works is you get one of the little filters ready from your bag, put that into the little space in the cup. That then simply locks into the machine, nice and easy. You'll have, first of all, a list of contraindications come up on the screen. You accept that, accept the terms of use, and you're good to go. And it comes with a little reminder saying, don't forget you need to have your filters on. Before you start using the LymphaTouch, don't forget, just do a really good assessment all around the areas. You're noticing the thickness, the textures, how that scar feels when you put a stretch on it, how the tissue moves, so that you can then reassess at the end to find out how that individual's feeling. We've got to think about, we get a lot of congestion around scar tissue, so we need to help with the drainage before and after a treatment. So we can do some nice sweeping strokes away just to introduce touch before we start with the LymphaTouch on. I'm going to start with the pulsing, and with the first time you're using it I'd suggest starting with a low pulse setting and then you can slowly work up. So I'll start at the lowest setting just so that the client can get to feel that. So we're going to start at 60. First of all, I'm going to show her on completely far away from her scar just what that feels like. So we've got a real gentle lift coming up into the cup there. I'm just going to try that near your scar. Does that feel all right to you?
Yeah.
So first of all, I'm going to work over the scar. So just as I'm holding this down, we're getting a lift into the tissue and then letting go. I'm watching the colour of the tissue as we go in there. Do you notice any pulling as we do that?
No.
That's good. And I can really clearly see that skin coming up, being lifted up into that LymphaTouch device. And coming back now along the scar itself. Got a nice little tummy rumble to show that we're really activating the parasympathetic nervous system. Starting to get some digestion happening, and lots of individuals who have had caesarean may well have some issues with constipation and so on, because you can have scar tissue forming which impacts our digestive system, and so this can be really helpful just to give that all a nice stretch and mobilisation. So then just have a little look, notice if you had any area that had really gone quite a dark colour red or that was staying red, then I'd be a bit cautious. I definitely wouldn't want to turn up to make that any stronger. Joanne's had some previous scar massage with me, so I'm perfectly happy to go ahead and do some more treatment. So just start off with one pass across the area on a nice low setting. Just check in with any change of coloration. If the person's fair skinned, that will be more obvious. If somebody's got dark skin, you may not notice. So you could also just use the back of your hand just to notice any temperature changes. If it really got very hot when you came across with the LymphaTouch, I definitely would be cautious using it in that area. It should cool down to normal temperature quite quickly. When you're ready, you can turn up So I'm going now up to 120. I always think it's nice to bring in a bit of stabilisation, so just a hand near to the area and just hold steady so they've got a nice bit of contact. And then sometimes with that extra hand, you can get a sense of which areas are struggling more to be pulled up into the cup. Don't be in too much of a hurry, so stay in one place, then slightly overlap your cup and place the LymphaTouch head down again next to it. Don't always come across the scar at the same angle, so you can come across the scar so that you're getting more of a longitudinal pull, so you're capturing more of the scar at the same time. By turning the cup the other way, you're getting a stronger pull up on that central portion of the scar line, which is going up into the cup. Or you can come at different angles. So changing the angle will have an impact on the tissues that are getting that suction onto them. Again, come off between positioning so that you can have a quick look at that scar. And any area that does go a little bit more pink, as long as it goes back down to normal coloration afterwards, indicates that you probably need to do a little bit more work there. Now we had a little bit of thickening of scar tissue here. Any difference in sensation on this?
Yeah, it feels tighter on the last two that you've done.
Yeah, so get that feedback from your client and just hang around in that area a bit longer. It should be that if you stay and repeat the application in the area that feels tight, as you go back across it, it feels a little bit more comfortable each time. So just all the time keeping up that communication with your client. If the client reported that actually the opposite was happening, that it was feeling more intense as you went back and forth over an area, I would suggest that it was getting irritated. I would certainly start off by really reducing the setting, and any sort of stingy burning sensations could indicate there's a little bit of skin damage occurring, and I would certainly turn the strength down quite considerably before continuing. How are you finding it as I go back and forth over this area?
It definitely is. There's probably the tighter one, but I think
a bit more intense.
Yeah.
And can you feel any of this referring into the low back at all, or is it only very local, the sensation that you get?
Very local, I'd say.
Then I'm going to come at a different angle over those bits where she really noticed that there was quite a lot happening. All right?
Mm-hmm.
Now, it can be helpful to also include the vibration setting that's on the device. It's going to make a little bit more noise, but what it does is it adds a little bit of oscillation through to tissues, and that can be really helpful. Particularly, we've got one area where my client noticed that there was a bit of numbness, and so we're going to really target that. How does that feel to have the vibration?
Yeah, fine.
I'm going to come back onto that bit that's a little bit tight and see if that feels a little bit less intense now with the vibration. Or is it about the same?
About the same.
So that was at 60 hertz vibration. Now I'm going to try at 20 hertz. So this is now a slower vibration. So it might create a little bit of a different stimulation to those tissues. How does that feel to you?
Yeah, it feels good. It's not quite as intense.
Yeah. Now, in between, if you're going to change, if you do a certain type of treatment for a while, so there I was doing the pulse setting, I was going specifically along the scar, and I was just looking to see, then have a little reassess before you change your setting. So I'd like to do a bit of a broader treatment for Joanne, also to include that we're working around the wider area. In order to do that effectively, I'd like to have a bit of a stronger cup on, so I'm going to remove the smaller cup. I'm going to get one of those bigger cups ready. So I'm just going to start off when you have somebody who's had a C-section. There's been a lot of, potentially if they've had a larger baby, there could be some rib flare that's gone on, tension around the diaphragm. It could have also tension coming up the sides of the rectus muscle. So I'm going to start a bit higher up in this case. So stronger cut, we can see a little bit of pinkness occurring as you come off. We can see that we've got quite a nice big doming happening coming into the cup, and in order to move you want to wait until, you don't want to pull it off when you've got maximum suction happening. So in order to reposition, I'm taking my hand near, waiting till it releases, lifting off and coming again. So this is currently set at 180, and I'm going to be interested to see how that feels as I come down towards the scar, and also any change in that kind of erythema response, which might be more intense as we come down into some of the areas that the client mentioned as tight before we started treatment. So I'm just going to come across over to the hip here as well. Is that okay? Mm-hmm. Intense?
To begin with, but it's not that bad now.
So it quickly releases?
Yeah.
You can see that being drawn up into the cup. Now I'm going to go to the side there. Okay here?
Yeah. Okay.
And we come across above the scar. Is that too intense or is that okay?
Yes, okay.
So if this was the first treatment with a client that you've never done any scar therapy with before, I certainly wouldn't bring the cup too close to the scar, because you could have a lot of adhesion formation in the underlying tissues, which then with that suction could actually cause some irritation and leave the client with a lot of discomfort after the treatment. Joanne's seen me from very early after her baby was born, and we've done quite a lot to release the scar already with scar massage techniques, with the Restore C-section scar massage techniques. So at this stage I'm quite happy that the tissue's quite mobile, and we've already been doing quite a bit of assessment with her today and some other treatments to warm up the area before coming on with the LymphaTouch. Is that okay on the scar? Yeah. As I come over towards the area that's more sensitive, I just want you to say straight away if anything's too intense, okay? And again, I'm watching for the colours. So that stronger erythema response, that stronger dark red colour, and perhaps taking longer to return to normal colour might indicate we need a little bit more work in that area. If it's very, very dark, it might indicate that it's not ready for that kind of pressure. So I'm really happy that we haven't had a strong reaction even coming across these sore sections. Feel okay?
Yeah, fine.
Nice. I'm going to do the same coming down this side now. So again, thinking about tightness that your client may feel around the diaphragm and around that area, and then coming down around all of the abdominal area as well to give that some treatment. So we've done a little bit of release on the rectus muscle today, thinking about the work that my client's doing in order to really try and bring those tissues together after a little bit of upper umbilicus abdominal separation that she's got going on there. If you're going to try and bring those muscles together, what you want to make sure is that there's not too much tension from the more lateral fascial tissues, and the external obliques and so on can often be really, really tight in your post-pregnancy clients. So making sure that you incorporate that wider abdominal treatment into your C-section treatment. You shouldn't only be looking at the C-section. You really want to take a broad view right up to the diaphragm and consider what's going on in the hips as well. Any big difference for you treating one side rather than the other?
I'd say this side is naturally a bit tighter, but not a massive difference. Cool.
To work target directly over the scar to finish on that direct scar treatment. I'm then going to do that smallest cup. This is going to really target on the scar itself. If you've got a smaller cup on, you're going to want to turn up that intensity. So I'm now going to come up to 2, 4, 5, and you're going to feel just a smaller area is being targeted. How's that pressure for you?
Fine.
Yeah. Again, just working over it. With the LymphaTouch, you can set the pulses depending to have it held up for a longer duration and to have a different gap between those pulses as well. It's got quite a few different adjustments that you can do to make those personalised settings that work for you and the kind of clients that you treat. I've found it really helpful and a really fantastic addition when I'm working in Harley Street. I'm using this on clients quite regularly, and particularly useful for clients who find that they've got concerns about scar adhesions because it really lifts up the tissue. How's that feeling?
Fine.
So again, with this little cup setting, it's really good if you've got a client who's had like a drain or something like that in for a bit longer. You can target those drain scars, which might not present as being very big scars on the surface, but then in the underlying tissue, there can be quite a bit going on for those as well. Now, some of the areas as I've come across with this much more targeted cup have definitely been more responsive than they were with the bigger cup. So the tissue goes a lot more pink because I'm really targeting the areas that need it. So it'd be a good idea to go backwards and forwards and do a bit more of that. Just before I finish off this little demonstration, I'm just going to be showing how it can be really helpful for just tight muscles. And when my client came in today, she said that she's got a lot of soreness in her back, which is really common after C-section. And you can combine the LymphaTouch not just to use for scar treatment, but actually to do some nice massage with some negative pressure as well. So I'll reposition her and get the cameras back on.